to Buddha's International TV 9 a.m. News Bulletin on 29th April 2020. I am Dr. A.B.M.K. Varaprasad, Managing Director, Nature Science and Medicine Hospitals Private Limited, India, updating from India,
Voice.
and President of Human Rights Council of America, Chicago. Padma Shri Dr. Vijay Kumar Shah, who is a social
Activist.
worker for more than 50 years and fighting for the health education as well as to the environmental protection. Welcome sir, updating from India. Dr. Ramakrishna Shah, UN representative and President of Human Rights Council of America, President of Buddha's World Peace Union, and updating from USA. Dr. Chalaka Jayasinghe, famous film producer, updating from Australia. Welcome sirs. If we see the complete data of the world today, more than 31 lakhs cases were registered so far, and out of that one, nearly 2 lakhs 18,000 people died. But the thing is, only 3% of the cases are in critical condition, and the rest of the 97% are in mild condition. So, that is the world update. Dr. Vijay Kumar Shah, could you please update from India?
India at present, the total number of patients is 29,400 and record patient nearly 7,000 and 934 deaths. In Maharashtra, 8,600 patients, record 1,200 and deaths are 360.
Okay, sir. Thank you very much. Dr. Ramakrishna Shah, could you update the data from USA?
Yeah, USA have a still problem. Total cases is 10,35,000. People recover 1,42,000, and total death is 59,000.
Okay.
In whole USA.
Okay.
And in Chicago, I'm living in Chicago, and in Chicago, 48,000 total case, and total death is 2,100, and big rate in the Newark. So Newark, total case is 3,01,000, and total death in Newark is 23,000.
Okay, sir. Thank you very much. Dr. Chalaka Jayasinghe, could you please update from Australia?
Yes, at the moment I got the information 6:30 in the morning today, like 29th April. We got confirmed cases 6,738. There have been 13 new cases since 6 a.m. in the morning. 88 people died since of this season. 5,649 have been reported as a report from like COVID-19 virus they survived, and more than 500,000 people have been conducted across the Australia, like they did their test, and finally everything alright from that area. Thank you.
Thank you very much. And even till today, even today also, according to the world report, the North America and Central America, particularly from Mexico, registered highest number of cases. Even Guatemala, Honduras, Nicaragua, Costa Rica, and Panama also registered more cases. And come to South America, still Brazil and Bolivia registering the cases. And come to African continent, the cases are somewhat low. And we know that already in the European countries like the Spain Okay, Germany, UK, and those countries, Italy, also facing problems with this coronavirus. Come to Asian continent, so the China as well as South Korea also registering new cases. This is the present situation all over the globe. What we have to analyze in this context is, no doubt, according to Dr. Ramakrishna Shah, the total number of tests were done more in the USA, that's why more number of cases were registered. But whereas in other countries, the less number of tests were done, that's why less cases were registered. Okay, this is a fine, good statement. That is true. And apart from that one, if we see in a particular country, the test kits also, okay, creating little bit of problems. So that type of news also going on here and there. Okay, now we'll analyze about that particular issue. And what about the social conditions and the people lifestyle in India and Maharashtra? Could you please update Dr. Vijay Kumar Shah?
Yes, now the conditions, the people, this thing, we are getting all the facilities. No problem of food, no problem of vegetable, no problem of milk. So day by day we are going improving. The only this thing that we have to give the moral support to the patient, those who were positive and they become now negative.
Yes.
So we have to give the moral support to them, because sometimes even they get at their home or this thing, the people they think in very different way. Somewhere they are welcome.
Yes.
But is there a problem? So we have to encourage these people.
Yes.
And the immunity.
Yes.
We have to help for the immunity.
Thank you very much, Dr. Vijay Kumar Shah and Dr. Ramakrishna Shah. And still New York is registering highest number of cases. And what type of precautions are taken by the people, and what type of moral support you are getting from government as well as come to other scientific communities, sir? Could you update?
Yeah, here government doing great job. Government provide a lot of facility and lot of store is open now. Food store and vegetable store is 24-hour open, and no problem for food here. And lot of people stay home, and people use this time now all using the mask. So this is the good situation, and now also decreasing the death in the USA.
Yes, that's
so. And government also support all the state. So this is the now in decreasing rate in the USA.
Okay.
Coronavirus and corona death.
Okay, thank you very much, sir. Dr. Chalaka Jayasingam. And what about the social conditions in Australia? It means whether the people are getting the groceries regularly, and what about the other people's lifestyle in the Australia, sir? Could you please update?
Yeah, like Australia is a multicultural country.
Yeah.
Like at the moment, we have to keep the normal people's distancing. The other part of that, all the food stores, the service station, fuel stores, everything back to normal. At the moment, the clubs, pubs, that things are closed. There is more gathering from that places. So far, school closed for another 1 month. Some states, like some Sydney, Brisbane, some state, they already start the school. In example, Melbourne, where I am living, the school it's open, but the kids have to study from home.
Okay.
Definitely at the moment, like back to normal, we compare with the other countries. Last night, I think they found around the Australia only couple of cases. Example, in Melbourne, only 2 people found for the coronavirus. Everything back to normal.
Okay. That's wonderful, Eddie. And at the same time, see here it is again, the schools were opened and some type of work is going on according to your words. So that's why, what type of measures you are taking to open that schools as well as come to other small works also? Now, any strong recommendation from the governments or what type of methods followed by the common people?
For the Australian government?
Yes.
Yes, they arranged the payment plan for the workers who lost the job.
Okay.
And kids have to get some government benefit also. Their parents can get the benefits. Yeah, that's what the government having a very good plan. Like, we don't need to stay from the queue. Like, the money comes to the direct bank account. Yes, something like that. They are in the very good system for the Australian people. Like, they have only one problem who coming from the overseas as an international student. They having a problem like they can't get any government benefit, like they came to Australia for their overseas studies. They have to spend their own money.
Okay. Thank you very much. Dr. Vijay Kumar Shah, we need to extend our moral support to the patients, so that's why could you please suggest some motivational words about those patients, sir?
Yeah, sure. Say, nowadays, the government officers and police people and everybody and in the public also, we got a lot of awareness. And now the people are encouraging them to have a normal behavior and they share their experience, how they were involved in the corona, how they landed, how they recovered. So they are giving their good example, and they are very happy what the government has treated them in the hospital in the quarantine period. It is very, very positive. This thing, they are 5-star facilities,
Yes, sir. That's a wonderful recommendation, sir. And here, no doubt, it is giving a lot of fear to the patients. It means after getting the coronavirus and what about our lifestyle? In that, they are getting a lot of fear, and at the same time, in the quarantine period also, a lot of moral support. Actually, they are not getting up to the mark, so that's why they are under heavy tension. So that's a recovery time also. And taking more time. So that's why we need to support morally to the patients. Now here I would like to mention the main point. My dear people, so after getting the coronavirus, no need to get any fear, because according to Journal of American Medical Association, it is just more than a common cold. What type of treatment you are giving to the common cold people, similar type of treatment you can extend to these people. So here it is. Because of your immune system, only 80% of the people are recovering without any special treatment. Only 20% of the people, if the weak immune system, they are taking a little bit of more time. This statement was given by World Health Organization. So that's why no need to get any fear about that one. The only thing is, and you are always thinking only about the medicines part. Why don't you think about to improve the immune system? So that's why no medicines, no vaccines. That's why what should I do? In that way, the people after getting the positive, now they are getting the fear. So that's why if you improve the immune system, nothing is required to you. So that's why take a healthy diet and healthy lifestyle you have to follow. Then definitely you can recover very easily. So that's why no need to fear about that particular things. And Dr. Ramakrishna Shah, and please suggest some more measures to motivate the people, those who are suffering from this coronavirus positive.
Positive people, government this time treatment so nice, and they give a lot of facility for positive people. They manage very nice hospital, everything. So no have problem for positive people. But government also doing big planning for check up the quantity of people for testing for coronavirus. So this is the great thing in USA. And now in USA, people completely stay home. He take mask. He take green vegetables. So this is a good thing here now.
Yes, sir. Thank you very much, Dr. Chalaka Jayasingha, and please motivate the corona positive patients, sir.
Actually, I can't give give a much idea about that, like.
Because the people are getting fear, sir. People are getting fear, so that's why you use some your motivational words.
My point of view, like some people like think about more, they worried about more. My point of view, like I am not worried about that much.
Yes, sir.
I got a bit of cough and the flu last week, but I did myself, like
Yes.
I went to the hospital and I did the coronavirus test and everything is alright, no problem. I'm telling to the people, we have to be careful. Like when we gathering, when we talk with the people, we have to use the mask. What we are doing when we working, we have to use the gloves and we have to be sanitized by themselves. That's what we have to do it for the survive the reason. Even we can't see our friend, we can't see our parents. Because of that reason, everybody, every cultural, doesn't matter we are American or Australian or Sri Lankan or whatever, the people, human being, everybody have to be careful, have to be safe from that side.
Yes.
Thank you.
Yeah, thank you very much, sir. And see, the people are getting fear by seeing the numbers also. For example, if we see the total cases more than 31 lakhs and come to number of deaths is around 2,17,000, which is approximately 6%. So 6% of the people are dying because of coronavirus. In that way, the people are getting fear. My dear people, and the 6% are dying not because of coronavirus. Out of that one, 5% of the people are coronavirus plus other health problems. Because of the chronic diseases, now they are dying. So it means only coronavirus people are dying, just only 1%. So that's why, so here it is, why do you get that type of fear? So anyway, per annum, if you see, come to other diseases means, so in this last 3 months, the death rate also very low. So that's why, if the person is dying with any reason, this is the period of the corona time, that's why everybody is claiming, let us say, corona disease only. So that's why this is not the correct method. So that's why, out of the 30 lakhs, okay, and maybe it is, yes, 1% means only 3,000 people are only with coronavirus they died. So that's why, and rest of the people not with only coronavirus and of course other health problems, and those who are more than 60 years and 70 years and suffering from a chronic diseases for more than 15-20 years. For that type of people, okay, after attacking this one, now the people died. So that's why do you get such type of fears? So that's why no need to worry about that one. So that's why, and if you can able to take the good measures, definitely out of the 6% is death, we can reverse the 5% reverse very easily. We can reverse. Maybe the 1% those who are suffering from chronic illness for a long period, for more than 3, 4, 5 varieties of diseases, for them it is maybe a difficulty, what we are saying. But the rest of the 5% definitely we can block. So that's why I can say 99% of the people can be recovered. Those who are affected. How can you say 80% of the people recovered without any special treatment announced by World Health Organization? And 20% of the people are suffering. And out of the 20% people, okay, and if you see 19% can be recovered. How? Means if you take the 19% time means first 10% of the people they may take 3 weeks, because maybe some other health complaints also. Okay, 3 weeks. No problem at all. And come to the remaining 6% of the people, they will take more than 3 weeks, up to 1 month, no problem. Maybe the rest of the 3% of the people, they will take more than 6 weeks. But anyway, 19% of the 20 can be reversed only with immune system. Only with your immune system. And so that's why without medicines and without vaccines, the people are dying. So what should we do? This is the main psychological fear to the common man. So that's why, and you are the only person taking care about your body. You are the best doctor for your body. And psychologically, if you are strong, then only it is possible to recover. So that's why, no need to do anything. Just change your lifestyle from, okay, so far different lifestyle to healthy lifestyle. But with respect to the food, with respect to the sleep, with respect to sun rays, with respect to exercise, with respect to breathing exercise, with respect to psychological counseling, and so 99% of the infected people can be recovered very easily. So that's why no need to get such type of fear. So, and see, here it is another fear. What is that another fear is? after admitting to the hospitals, okay, after getting this positive, okay, our life is maybe ending. In that way, the most of the people are thinking, because in the hospital we don't have any so far medicines and so far vaccines. So that is the main fear. So here it is. Why don't you improve your immune system? Why always thinking about the medicines? To improve your, let us say, common goal, to improve, let us say, for common health problems, why always thinking about the medicines? So that's why no need to get any medicines, because it is not a serious issue, and this is depends upon the immune system. No doubt if your immune system is very weak, means irrespective of your age, irrespective of your other things, definitely, and it may affect small. But if you are sound, okay, in the case of your immune system means, and irrespective of the age, irrespective of the other things, definitely we can recover. So a couple from the from the UK, I think, yes, from the doctors, both wife and husband, both are, let us say, suffered with this coronavirus positive, and both are doctors, and madam also suffering from sugar and high BP, but they cannot go outside because of lockdown situations. Now, simply they followed which way? Only by taking the raw vegetable juices, by including garlic, ginger, turmeric powder, and within 8 days, without any treatment, they recovered. The doctors mentioned openly, no special treatment is required. But why the people are getting the fear by seeing these numbers? This numbers is not only coronavirus cases, this is coronavirus plus other health problems. So that's why 6% death rate is very high. In that way, the people are calling. So out of the 6%, only 1% is corona, and the rest of the 5% is corona plus other health problems. Other health problems. So that's why in that way we are motivating the public. Yes, in that we are motivating the public, and because of this lockdown, the people also facing some problems. Now let us see the position from India. Dr. Vijay Kumar Shah, please update from India's thing with respect to this lockdown situation, sir.
So I like this thing. The most of the patients, those who are died, what is the accused thing in my area in Maharashtra, most of them they had some chronic problems. They were suffering from tuberculosis, blood pressure, diabetes. They are the more reason.
Yes.
The healthy people are not died much. So what is my observation?
Yes.
And another thing, adjusting the diet.
Yes. Okay.
To improve immunity, what you say, you should have plenty of juices.
Yes.
Maybe a lemon juice, it is going to help you a lot.
Yes.
Instead of saline, you can have your buttermilk with the salt. It is going to improve. And daily exercise. And you do some meditation. Maybe you do the mantra or anything. I think it is going to help you this thing.
Okay.
And when you are sitting in the one family now, it is a good atmosphere. Everybody is very happy. And I think because of this, the gathering of the people, I think the patient are going to be improved very fast.
Yes. So, Dr. Ramakrishna Shah, here it is, most of the death cases from USA, and here it is, what is my opinion about that one is, out of the death cases, and more people are suffering not only with the coronavirus but also suffering from other chronic diseases, particularly obesity and heart complaints cases are more in USA. So that's why these chronic diseases, and you already mentioned that food habits also, not the fresh food habits they are taking, so they're not taking, so that's why food habits problem, lifestyle problem. So I think all these reasons, and apart from that one, the other chronic diseases also contributed a lot for this increase the death rate. So that is my opinion. And what about your opinion about this situation, sir?
Yeah, in the USA, mostly old people.
Yes, sir. Yes.
A lot of old people died, and they had infected of different kind of disease, diabetes, blood pressure. So, lot of old age people have problem for that kind of thing. Lot of old age people is died. And young people rate is so low in the United States.
Okay.
So, my opinion, maybe old people have, after old age, of disease, lot of tension, lot
Yes,
of
sir.
this, that, and so old people mortality is high.
Yes, sir. Thank you very much, Dr. Ramakrishna Shah. And I think the same thing happened in Australia also.
In between, there is the addictions. The most of the people, they have passion, maybe smoking, maybe eating tobacco, and this thing. This is one of the reason also they got a low resistance.
Yes.
Yeah.
This is a very important point we have to remember. And I think the same thing happened with respect to even Australia also. Dr. Chalaka Singha, and out of the recovery cases and out of the any other critical cases, and what about the age groups and their healthy habits, sir?
Yeah, the age group, whatever the Professor Ramakrishna Saab said, the same thing. The older people who
Okay.
stay in
Yes,
the aged care centers, like 88 people died. I think more than 70 people from the aged care people, the older people. The young people, they do their daily routine things like
Yes.
they practicing, they running, they do all the exercises.
Okay.
They reduce their food,
Yes.
whatever the Professor is saying, like people not gonna smoke or drink much. People like they stay at home,
Yes.
they cover by themselves.
Yes.
That's not my opinion. People have to be safe. The younger people also don't think like we can't get the coronavirus.
Yes.
Everybody have to be safe.
Yes.
Stay at home, do their daily work routine.
Yes, thank you very much, Dr. Chalaka Jayasingha. And see, here it is, the final conclusion is, and if we maintain our immune system, and no need to fear about that one, and out of the death cases of 2,17,000 all over the world also, and most of the cases are because of the chronic diseases only they died, and not only because of this coronavirus. That's why no need to get any fear. So about this one, and come to the lockdown situation, and the below poverty line people and the daily wage workers are facing lot of problems, particularly in the developing countries and underdeveloped nations. Maybe in developed nations, the government is helping them to a large extent, and for them that is not a problem at all, even for lockdown of even 3, 4, 5, 6 months also. But come to in the developing nations like in India, and the news is giving lot of fear to us. So that's why, and the people already struck in different areas, and the daily wage workers are not at all getting even the food also, because the NGO organizations they are providing a food packets. So how many food packets per day they are supplying, and how many days they are supplying, because NGO organizations are also suffering financial problems because of lockdown for the more than 1.5 month. So that's why this is a very critical condition is going on. So that's why, and what type of measures we have to take about for that one is very important. And lockdown, what is mean by that one? Here it is, for how many months we have to extend the same type of things it is. So that's why here it is, no, lockdown is very good, no doubt at all. At the same time, what type of measures we are taking for the common people? I think in the coming months, in the developed and countries fine, but come to the underdeveloped nations and developing countries, more death rate takes place because of starvation and compare with the coronavirus situations. So that's why all the respective governments, I think they must extend the service, and the people also they must extend the service. And with this one we are signing off today, and thank you very much for updating today's issue. Thank you very much.